Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Get that. Yeah, you ready for this? This deep dive. It's about genes,
Okay.
income, and health. Three things you wouldn't think are really connected.
Right.
But this new research from Nature Human Behaviour,
Yeah.
it's kind of blowing my mind a little bit. I mean, we've all heard that people with more money
Right.
tend to be healthier on average.
Uh-huh.
But like, what if your genes play a role in that too?
Yeah. It is fascinating, isn't it?
Yeah.
We often talk about this thing called the socio-economic health gradient.
Yeah.
And that's that kind of global pattern where higher income usually means better health.
Right.
And the research seems to point to access to things like
Mm-hmm.
good schools and safe neighborhoods being more important than just being able to afford a doctor.
Yeah, the socioeconomic health gradient.
Right.
It always makes you think,
Yeah.
But here's the kicker.
Yeah.
This study says that genes
Right.
actually factor into this whole equation, too. Apparently, they can account for something like 1 to 5%
Yeah.
of the difference in people's income.
Wow.
Seriously.
Yeah.
That's way more than I would have guessed.
It does seem small, but statistically speaking,
Mhm.
with the sheer number of genes we have,
Right.
even tiny effects can make a difference.
Right.
Think of it like adding a pinch of spice to a recipe.
Okay.
It can subtly alter the whole flavor profile.
Okay, that makes sense.
Yeah.
But now I'm picturing some kind of like money gene
Oh.
that just like predetermines your salary.
Uh-huh.
Like, are we all just puppets of our DNA?
Not at all.
Okay.
This research isn't saying your destiny is written in your genes or anything like that.
Okay.
It's more about a
Yeah.
complex dance between nature and nurture, like
Yeah.
your genes and your environment.
Right.
Those genes might influence traits that could affect income.
Yeah.
But how those traits actually play out depends on things like
Ugh.
your family, your upbringing, the opportunities you have,
Yeah.
all those external factors.
That's a relief.
Yeah.
But it does make you wonder,
Sure.
what is it about these genes that gives them this income link?
Right.
Are we talking personality here?
That's a great question. And
Yeah.
this study uncovered another really fascinating link.
Okay.
These genes that are associated with income are also linked to education level.
Oh, so knowing that genes play a role,
Right.
it makes you wonder,
Yeah.
how does education actually fit into all of this?
Mm-hmm.
Is it as simple as certain genes just make you smarter,
Oh.
so you do well in school and get a high-paying job?
Well, while intelligence certainly plays a role, it's
Yeah.
not the whole picture.
Right.
These genes might be influencing a whole range of personality traits that could affect
Right.
both education and income.
Uh-huh.
Things like perseverance,
Right.
risk-taking behavior,
Okay.
social skills, even simple curiosity.
So it's not that these genes are like dictating your future.
Oh, right.
But they might be shaping the paths that you take in life.
Yeah.
That's really interesting.
Uh-huh.
But hold on, we've got genes linked to income,
Right.
genes linked to education.
Right.
It's getting complicated.
It is.
What happens when we try to isolate the genes
Okay.
that are specifically tied to income,
Mm-hmm.
separate from those connected to education?
Yeah.
What did the researchers find there?
Okay, so this is where it gets wild.
Okay.
These income-linked genes,
Yeah.
they're linked to feeling good,
Okay.
happiness,
Uh-huh.
life satisfaction,
Uh-huh.
but also to things like smoking.
Wait, what? Better mental health, but also more risky behaviors?
Yeah.
That seems contradictory.
It does, doesn't it? That's the million-dollar question.
Right.
What exactly are these genes influencing? Drive,
Uh-huh.
ambition,
Oh.
decision-making?
Yeah.
It's scientists are just beginning to piece together.
Okay, this is blowing my mind a little bit. Yeah,
Yeah.
I need a minute to process this. So we've got these genes that seem to be tied to income,
Right.
and they might be influencing things like risk-taking and how happy we are.
Uh-huh.
But how does that explain the connection between income and health?
Well, remember that the study found a link
Right,
between these specific income-linked genes
right.
and better mental health outcomes.
Okay,
So it seems like those genes might be playing a role
right.
in both how much money you make
Yeah.
and how you feel mentally.
Okay, that makes sense. But I'm still stuck on this whole smoking thing.
Sure.
How can those same genes be linked to risky behaviors?
That's a fantastic question. And it's
Yeah.
one that researchers are still trying to figure out.
Okay.
There might be a common factor that influences both
Right.
risk-taking behavior and feelings of well-being.
Mm-hmm.
For example, maybe these genes influence
Okay.
personality traits like impulsivity
Yeah.
or being a thrill seeker.
Uh-huh.
So someone who's more impulsive might be more likely to take risks, but they might also be more open to new experiences
Okay.
and therefore report higher levels of happiness and life satisfaction.
So maybe it's not that the genes are directly causing
Right.
both the risky behaviors and the good feelings,
Right.
but they're influencing some underlying personality trait
Exactly.
that can then play out in different ways,
Yeah.
both positive and negative.
Exactly. And that's why it's so important
Okay.
to look beyond simple correlations
Yeah.
and try to understand the complex mechanisms involved.
Uh-huh.
We need to understand why and how
Right.
these genes exert their influence, not just that gene X is linked to behavior Y.
Okay. I'm starting to see how this all fits together.
Yeah.
It's like those genes are setting the stage,
Huh?
but the actual play that unfolds can vary
Right.
depending on a whole host of other things, like
Yeah.
the choices we make, our environment, and our social context.
It's amazing.
It's fascinating how all of this is connected.
It is. It's a great analogy. Like the genes are setting the stage. But the play is shaped by so many other factors.
Right.
And speaking of the play,
Yeah.
you mentioned those income-linked genes were tied to
Yeah.
better mental health.
Right.
Which seems kind of counterintuitive
Yeah.
given the whole risky behavior thing.
Right.
What exactly do we mean by better mental health in this context?
Yeah, when you think of mental health,
Right.
you don't usually picture someone who, like, enjoys
Yeah.
a pack of cigarettes a day.
Right. Right.
What were they measuring in this study?
Good point. They focused on what's called subjective well-being,
Okay.
which is all about how people experience their lives. Things like life satisfaction, overall happiness,
Okay.
positive emotions, not just the absence of mental illness,
Right.
but a general sense of well-being.
So people with these income-linked genes tended to report feeling happier and more satisfied with their lives.
That's what the data suggests,
Okay.
even after taking into account their actual income and education levels.
Okay.
It implies that these genes might be influencing well-being in ways that go beyond those socioeconomic factors.
Okay, but we're still dancing around this correlation versus causation thing.
Right.
Is it the genes themselves causing both the risky behaviors and the positive well-being, or is something else going on?
Another great question. And the answer is
Yeah.
we don't know for sure yet.
Right.
It's possible. There's a common thread that connects both.
Right.
Remember those personality traits we were talking about?
Right.
Impulsivity, thrill-seeking?
Yeah.
Maybe those are influenced by these genes.
Okay.
And those traits just manifest differently in different areas of life.
So someone who's wired to be more impulsive
Right.
might be more likely to make risky choices,
Yeah.
but that same impulsivity could also make them more open to new experiences.
Right.
And as a result, happier overall.
Exactly. And this highlights
Okay.
why we can't just stop at
Okay.
gene X is linked to behavior Y.
Right.
We need to dig deeper,
Uh-huh.
understand the mechanisms,
Right.
the pathways involved.
Right.
It's like a detective novel. We've got some clues,
Yeah.
but we need to put the pieces together
Okay.
to solve the case.
It sounds like we're only just beginning to understand the complexity of this relationship between genes, income, and health.
Yeah.
But how does all of this research actually impact people in their daily lives?
That's a crucial point.
Yeah.
This research isn't just about abstract scientific concepts.
Right.
It has real-world implications, first and foremost.
Uh-huh.
It reminds us that our health isn't solely determined by our genes or our environment, but rather this fascinating mix of both.
It's not a deterministic view.
Precisely.
You're not trapped by your DNA.
You have agency in your health outcomes.
Right.
And second, this research underlines
Okay.
the importance of social and economic factors.
Right.
If these income-linked genes are tied to
Right.
both mental well-being and risky behaviors,
Uh-huh.
it suggests that tackling things like poverty and inequality could have a major impact on population health.
It's a powerful reminder that our health isn't just an individual responsibility.
Exactly.
It's a societal one as well.
Absolutely. And lastly,
Okay.
I think this research offers a message of hope.
Okay.
By understanding this complex interplay,
Right.
we can develop more effective and personalized strategies for improving health and well-being.
Instead of feeling overwhelmed or powerless because of our genes,
Right.
we can use this knowledge to make informed choices
Yeah.
that support our health.
Precisely, knowledge is power.
Right.
The more we understand how our bodies and minds work, the better equipped we are to take charge of our health and well-being.
It's not about getting bogged down by the complexity.
Right.
It's about embracing it and using that knowledge to our advantage.
Exactly. That's where the real power lies.
Yeah.
In understanding and harnessing the incredible complexity of human health.
Okay.
And this study focused primarily on European populations.
Right.
Which is a great jumping off point, but...
That's a great point. We've been like deep in this research.
Yeah.
But it makes you wonder how much of this applies to everyone, everywhere you know.
Yeah.
If the study mostly looked at European populations, can we just assume that these same connections between genes, income, and health hold true for people in other parts of the world?
That's a key question.
Yeah.
While this research is groundbreaking,
Right.
it's important to remember that different genetic backgrounds, cultural norms, and social structures could all influence how these factors interact.
Right.
What holds true in Europe might not necessarily apply in Asia, Africa, or the Americas, for example.
It's like we've just explored one neighborhood of a vast global city.
Yeah.
We need to see more to get the full picture.
Exactly. Expanding research beyond European populations is essential to understand the nuances and develop interventions that are truly effective and fair for everyone.
Right. It's about seeing the whole tapestry, not just one thread.
Exactly.
And I imagine there are tons of other questions that scientists are still trying to answer in this field.
Absolutely.
What are some of the big mysteries they're working on?
Well, for starters, actually pinpointing the specific genes involved in these relationships is a huge challenge.
Right.
And then understanding how those genes exert their influence.
Right. Like, is it
through personality, cognitive skills, social dynamics, or something else entirely?
Right.
It's like peeling back the layers of an onion. Every layer reveals more complexity.
Plus, we can't forget about the environment.
Of course not.
How does everything from your upbringing to your access to resources interact with your genes to shape your health and income?
Exactly. Even with certain genetic predispositions, the environment plays a huge role in how those predispositions actually play out in your life. It's like having a musical score. The notes are there, but the interpretation, the tempo, the feeling that comes from the musician and their surroundings.
It's incredible how interconnected all of this is.
It really is.
From the tiniest gene to the broadest social forces.
Yeah.
Everything seems to influence everything else.
It does, and this research has only scratched the surface.
Right.
But even with what we know now, it's a powerful reminder that you are not just a product of your genes.
Right.
Nor are you solely a product of your environment. It's the dynamic interplay of both that makes you who you are.
It's kind of liberating, isn't it?
It is.
This research could easily said, your genes determine your income and health, end of story.
Yeah.
But instead, it opens up this whole new world.
It does.
Of understanding and possibility.
Absolutely. It's about empowerment, not determinism. Right. It's about understanding the complex forces at play.
Right.
So you can make informed choices and shape your own path.
Well, I think we've given our listener plenty to think about today.
I hope so.
This has been an incredible deep dive.
It has.
Exploring these surprising connections between genes, income, and health.
It's been a pleasure unpacking these ideas with you.
Likewise.
I hope our listener has walked away with a deeper understanding of how interconnected everything is.
Right.
And a renewed sense of agency in their own health and well-being.
And remember, listener.
Yes.
This journey of discovery doesn't end here.
That's right.
Keep exploring, keep questioning, and keep those wheels turning.
Absolutely.
Who knows what other amazing connections are out there?
Right.
Just waiting to be discovered.
Exactly.
Thanks for joining us on The Deep Dive.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.